DMS, Apollo Hospitals. Sir is here with us and has been in new clinical programs to the hospital, and 100 colorectal surgeries in 1 year for the region as such. And today he has been, I would say, a mentor to us and has helped us in launching this program for the first time in Odisha. I also take the pleasure to introduce Dr. Salil Kumar Parida, Bhubaneswar. More apna khali gotiye request je Dr. Venkatesh will understand only English. So my request to post your questions to Dr. Venkatesh in English, to Dr. Alok in both English and Hindi, and to Dr. Salil in whatever Oriya language also is comfortable. So I will hand over to Dr. Alok Srivastava, I'll see our CEO come DMS, to take the program forward. Sir.
Thanks, Sukuma. A very good evening to all of you. It's a great privilege for us and a very proud moment for each one of us at Apollo Bhubaneswar, as today we have launched the robotic program for the people of Odisha. This is the first live surgery that surgeon, colorectal surgeon, Dr. Vinci Krishnan, along with Dr. Salil Parida. To say this, I think a couple of months for the launch of this program. Somehow today when we stand out before you to say that we have actually launched, it feels really a great moment for each one of us to say that we are doing it for the community. It has long list of things which my surgeon team would brief you on this. But most importantly, what I feel is important for us to share with you, that the length of stay in the hospital gets reduced with this technique of robotic surgery, and the outcomes are greatly improved in precisely what exactly a community or anybody would look forward to. So now I would hand over to Dr. Vinci Krishnan to take this forward from my desk.
Thank you, Dr. Srivastava. Thank you, the team and Apollo Bhubaneswar, for inviting us. This is an important event. We have surgeons who are, like Dr. Salil, who are established GI surgeons performing minimally invasive surgery. The introduction of robotics to this space extends their skill sets, which they already possess immensely. It adds another dimension to what surgeons can offer to our patients. Now, as you know, minimally invasive surgery, primary laparoscopy, has been around for almost 2 decades, and there are several surgeons across the country, several thousands of surgeons across the country who are experts in it. Now, as technology evolves, as we've seen during COVID times, how digitalization has changed the way we look at every field, particularly healthcare. The use of advanced technologies such as robotics is also is having a major impact, and it will change the future. The future of surgery is in some form will be delivered with advanced technologies such as robotics, artificial intelligence, and virtual reality. So extension of our surgical skill set will involve using robotics to what we can offer to our patients. Now, what are the advantages of offering robotics, and particularly in the short term, on top of laparoscopy, is that it essentially uses a platform which is more stable. It also has a camera system which are miniaturized as small as a pencil tip. So what happens is these cuts which we make normally, even for laparoscopy to go inside, they become smaller. So smaller cuts, less pain. Instruments are miniaturized, they are articulated. I think that's what the big difference between laparoscopic instruments and robotic. Laparoscopic instruments are two-dimensional. They come, they hold in. Robotic instruments are articulated like your wrist. So basically they mimic what a human hand can do, but remotely. The surgeon is sat on a console like how I'm sat here looking into a console, and it's connected via wires to a robot which is next to a patient. With these arms, 1 camera arm, 3 arms, which, as you see in the picture, with instruments which we can do the dissection, one can to assist. So you remove away the assistant factor, so that what happens is The surgeon has more control. You can look where you want to see. The instruments are miniaturized, can mimic what your hand movements are. And more importantly, the robot does not do surgery by itself. It only mimics or does every movement what you do with the joysticks is reflected inside the patient. If you stop, the robot will stop it. So it's not an autonomous robot, but it is advancement in miniaturization of the instruments. The camera gives you 10 times magnification of three-dimensional views. And also more importantly, we've never looked at the surgeon comfort. You know, traditional laparoscopy patients are standing and, sorry, not patients, the surgeon is standing and operating. Long surgery like what we've done today, although we finished in 3-4 hours, that's because of the expertise of Dr. Parida and the team which we have in Bhubaneswar. Over a period of time has an effect on on the joints, shoulders, varicose veins, or whatnot, on the surgeons too. So the longevity of the surgeons is important, and we've never looked at it. We've just looked at patients, we looked at outcomes, but also the surgeon is important. That's where this platform, where you sat comfortably in a chair with your arms rested, more stable, there is no tremor. I think all these things will benefit the patient. Now, if you look at robotics itself, particularly in the colorectal space, what we're seeing is that more and more specialization is coming into play. In the old days, surgeons were general surgeons. They did lots of things very well. But more and more technology has evolved. Diseases are becoming more complex. Treatments are becoming more complex. So we don't have a one-glove-fits-all formula anymore. So we have surgeons who do just gastrointestinal work. And more so, what we are going into or seeing is that surgeons doing just colon and rectal work or hepatobiliary work, so that you do lots of volumes and become experts, so that that expertise is available locally in Bhubaneswar, and patients don't have to go far away like Delhi, Chennai, wherever. I think that will change in the next 5-10 years. And a hospital such as the Apollo Bhubaneswar is ideal for it, and that's what the team here is trying to develop. Now, in the short term, as subspecialization expertise evolves, robotics has got lots of short-term benefits. As I told you earlier, the advantage of the equipment is, but what we're seeing is it's less blood loss, quicker recovery of the tissues, less length of stay, quicker recovery of patients back to work. And the technology itself is expensive, but we are also seeing, as we are seeing in Chennai, within the Apollo network, is that the more volumes you do, the cost more or less levels out, same as laparoscopy. So I know the program is young here, but I think the plan is to involve gynecologists, urologists, general surgeons, all to be part of this robotic program, but with subspecialized surgeons doing more volumes, so that the cost will also come down in a year or two as the program matures. And I'm pretty sure about that. Not only that, there are several new robots which are coming into play. So what happens is the competitors will reduce the cost. So we have to, as we start the program, mature into it, all these factors will come into play. And within a couple of years, we should have a very robust program, which is nothing new, but part of what a service which we offer to our patients, so that our patients in Bhubaneswar and Orissa don't have to go to other states or other cities. And your expertise is going to be available locally. Thank you. Dr. Salir?
स्वर्ण अक्षर रे आज शिखिबा आरंभ करथिले नाउ सेही एडवांटेज देखि धीरे धीरे टायर 2 सिटीज रे भी रोबोट रो प्रोग्राम आरंभ हैला आउ वी आर फॉर्चुनेट एनफ कि आज आमे सेही सुजोगटा पाइलु एंड formally we are launching the robotic GI surgery program in Orissa. This is the most advanced system of robot जोटा आमे आज यूज कलु समस्तंकर गोटे डाउट था कि डूइंग सर्जरी तो आउ सर्जन रोल कौन तो इट्स डाउट इज जेन्युइन बिकॉज आपण मैंने बहुत यूट्यूब वीडियो आसीगलानी बोस्टन रोबोटिक्स स्पेशली देखुवे छोट छोट मिनिएचराइज रोबोट अच्छी छोट छोट काम भी करें आप चा ग्लास भी रोबोट दे दूची आपन को गोटे जिनस तलू उठे कि थोई दूची ठीक जगह बट सर्जरी इज नॉट लाइक दैट सर्जरी इज एंटायरली द रोबोट इज अंडर कंट्रोल ऑफ द सर्जन सर्जन जेबे जाए चाहिए रोबोट जहाँ सर्जन मैनिपुलेट करिवो इंस्ट्रक्शन दब जो अनुसार टिश्यूज बा स्ट्रक्चर्स को काटिया चाहिए रोबोट एक्जाक्टली से जिनस रिप्लिकेट करिवो तो व्हाट इज द डिफरेंस आपण मैंने पचारे व्हाट द डिफरेंस ताले नॉर्मल लाप्रोस्कोपी कहीं करेंगे नाउ एडवांटेज है लाप्रोस्कोपी लाइक मुझे like there will be tremor, right? अपन आज ही क्रॉस सपोज आई विल बी 60s ओके मैं धीरे 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 जो सर्जन एज हुए तो ट्रेमर स्टार्ट हुए हाथ हाथ थरिया स्टार्ट हुए तो से यू कैनॉट लीव सर्जरी इट्स आवर जॉब राइट सो इफ यू सी दैट वन प्रैक्टिकल एस्पेक्ट ऑफ इट इज ए सर्जन irrespective of age if he is fit to sit he can operate the surgery as the age evolves जते मनीष एज हुए से एक्सपीरियंस बढ़े सर्जन जते एक्सपीरियंस हुए सर्जिकल रिजल्ट भी भल हुए बट सर्जन एफिशिएंसी छिड़ा कि 6 घंटा 7 घंटा सर्जन एफिशिएंसी धीरे धीरे कमी जाए robot the biggest advantage of robot is surgeon can sit and perform the surgery without any glitch of tremor that is the biggest advantage सर्जिकल स्ट्रेस आधे सर्जन बिकॉज आप जानी पड़े सर्जरी इज ए स्ट्रेस फॉर द पेशेंट एंड फॉर द सर्जन ऑल्सो कैंसर सर्जरी इज नॉट एन इजी टास्क टू परफॉर्म कैंसर धीरे धीरे बहुत इवॉल्व हो गलानी आ कैंसर रिजल्ट्स भी धीरे धीरे बहुत स्पेशली सॉलिड कैंसर जो अच्छी तार सर्जिकल रिजल्ट उपर पेशेंट रो लाइफ निर्भर करे तो जिते फाइननेस से सर्जरी हम पेशेंट रो लाइफ स्पैन को सेते से ऐड करि परिबो तो आ फाइननेस डिपेंड करे सर्जन रो पेशेंस ऊपर सर्जन रो फिटनेस ऊपर जोटा ओवर द एज यूजुअली कमी जाए बट रोबोट हैज एडवांटेज यू कैन सीट यू कैन परफॉर्म यू कैन रिलैक्स एंड डू द सर्जरी रोबोट जो सर्जन रोबोट को कंट्रोल करे फर्स्ट एंड फॉरमोस्ट जिनस हला it has the 8 degree of freedom 8 degree अपन जानी पड़े आपन शोल्डर अच्छी आपनकर एल्बो अच्छी रिस्ट जॉइंट देन 3 joints 6 joints are there but robot has 8 degree of freedom ओके मु हाथ जदि बुलेबी मैक्सिमम बुले कि 360 डिग्री हम राइट 360 टू टिके कम हम बट रोबोट आम जब बुलेबा एमती बुलेबा अप टू 360 प्लस 180 5 more than 500 degrees of freedom it is providing and usually basic advantage कौन आधे लाप्रोस्कोपी अपन मैंने जानी थे आगु ओपन सर्जरी होता बहुत पेटरे बहुत बड़ गोटे इंसिजन दिया होता अराउंड 10 to 15 सेंटीमीटर सर्जन को जो असिस्टेंट सब खोलिक रखुले पेट को ऑपरेशन सर्जन करुले लाप्रोस्कोपी धीरे धीरे छोट छोट कणा करके सर्जरी आरंभ है तो लाप्रोस्कोपी कौन करा जाए प्रथम पेटरे गैस पूरा जाए पेट को फुला जाए गोटे स्पेस क्रिएट करा जाए तापरे इंस्ट्रूमेंट पूरेकी से जो ऑर्गन ऑफ इम्पोर्टेंस ताकू धीरे धीरे डिसेक्शन करा जाए तो बेसिकली बहुत हैंड मूवमेंट हुए शोल्डर पर बहुत प्रेशर पड़े से जिनस आपण कर एंड देयर वोंट बी द डिग्री ऑफ फ्रीडम्स आर मोर वी आर एट द फ्रीडम ऑफ मूवमेंट जोड़ा कहा जाए सर्जन को बहुत एडवांटेज मिले आउ ट्रेमर पूरा न्यूट्रलाइज देयर वोंट बी एनी ट्रेमर हाथ आदम थरबनी से जो स्ट्रक्चर ये कला बेले तो नेक्स्ट जिनस कौन लाप्रोस्कोपी आप निजे एकुटिया केबे करि परिबेनी जने कैमेरा देखा पड़ो से कैमेरा देखेबे तापर आप ऑपरेट करेंगे रोबोटर इंपोर्टेंस है कौन कैमेरा ऑटो फिट अच्छी आपण कैमेरा को निजे कंट्रोल करेंगे आप एक्सटर्नल कैमेरा किसी ना से इंटरनल कैमेरा आपण निजे कैमेरा को कंट्रोल कले चाहिए जब भितर को जी साइड को देखिए चाहिए निजे साइड को देखिए लाइक रोबोट आपण आज आपण निज आखिरे सब जिन करूँ आपण क्या आखिरे डिपेंड करना क्या ऊपर डिपेंड करना दैट इज द बिगेस्ट चैलेंज तो क्रिटिकल एरिया मनकर सर्जरी करूँ हठात ब्लीडिंग हो गला तो कैमेरामैन मनकर से टाइम भिजिलांट ना तो आप देखिपारे बट आपण जो सर्जरी करछन्ती निज आखिरे देखुछन्ती आपण निजे सीट विजिलेंट ही करबे दैट इज वन ऑफ द वेरी जो एडवांटेज ऑफ रोबोट वन मोर थिंग इज आपण नॉर्मल आमे जो ए जो नॉर्मल एनवायरनमेंट इज इट्स ए 3D एनवायरनमेंट राइट बट आमे यूजुअली जो टीवी देखू दैट इज ए 2D picture okay laparoscopy also it's a 2D picture now 3D pictures are coming on this is a very costly thing robot is providing you a 3D picture so if you it's as if you are inside the abdomen and operate abdomen bhitere apan pasiki operate kala bhaliya lagibo and very minute work you can do very minute work even small vessels small the structures less than 4 millimeter, 3 millimeter structures also you can see finely dissect and operate. Robot is evolved in a such a way that people are doing renal transplant nowadays. Kidney transplant bhi robotic re samane kari paruchanti. And definitely it has a future and Odisha vasinku definitely Apollo paribar tarafuru गोटे रोबोट हिसाब रे गोटे उपहार डेफिनेटली मिली आज या द्वारा डेफिनेटली आमर जो पेशेंट माने बहुत उपकृत हेबे प्रथमे जो रोबोटा स्टार्ट हला से यूरोलॉजी सर्जरी रे बेसी यूज हला यूरोलॉजी सर्जरी रे आ कोलन सर्जरी रे बेसी यूज हला एबे सबु प्रकार कैंसर सर्जरी रे एटा व्यवहार यूजुअली आमे व्यवहार करि परिबा छाती रे कैंसर हला पेट रे कैंसर हला लिवर रे कैंसर हला पैनक्रियाटिक कैंसर एनी सॉर्ट ऑफ कैंसर रोबोट इज देयर फॉर योर हेल्प सो डेफिनेटली इट मेक सर्जरी सो मच इजी दैट जने नुआ सर्जन भी जदि रोबोटिक रे एंट्री करंती तो बहुत जल्दी सीखी जानती डेफिनेटली इट हैज ए फ्यूचर एंड सर जो कहले कि एबे जतो Da Vinci system that the oldest system that's the one of the most finest system जेतो initially ता पाखरे patent थिला the cost of treatment was very high actually now धीरे धीरे मार्केट रे 3-4 कंपनी रो रोबोट आसी गलानी तो कॉस्ट ऑफ ट्रीटमेंट सब्सिक्वेंटली एबे जहाँ अच्छी सब्सिक्वेंटली धीरे धीरे सिंस मार्केट कॉम्पिटिटिवनेस बढ़ला परे कॉस्ट ऑफ ट्रीटमेंट आल्सो इट विल गो डाउन आउ अपोलो तरफरु एबे आमे जेहेतु रोबोटिक सर्जरी एबे इट्स इन इनिशियल फेज डेफिनेटली जो पेशेंट भी एबे आम पाखु आसीबे वी कैन ऑफर देम ए प्राइस रिडक्शन फॉर द at least next few cases or few number of cases also आउ धीरे धीरे सबु ब्रांच जमिति आई सपोज टू डू सर्जरी इन abdomen रो कैंसर जहाँ भी सर्जरी आमे करू तादरे आई एम ट्रेन सो वी आर यूजिंग इट धीरे धीरे आमर गायनेकोलॉजिस्ट यूरोलॉजिस्ट कार्डियक सर्जन ऑर्थोपेडिशियन आल्सो दे विल बी ट्रेन सो ऑलमोस्ट सबु डिपार्टमेंट रे ए रोबोटिक सर्जरी भी आपरे परे हेई परिबो तो really I am very much thankful to Apollo for providing us this platform to perform this robotic surgery today and now we can love to answer your questions.
परडा शुणु आप जो रोबोटिक जो सर्जरी कर इट इज ए गुड माने भल ओडिशावासी भल पदक्षेप किंतु आप जो कैंसर केवल कहीं एक्सक्लूसिव रखुच्च अदर सर्जरी आप कौन करेंगे कि से गोटे कथा तापर आप जो सब टेक्निकाली जहाँ सब कहले जो 3D विजन रे आप भीतर जाइए करेंगे माने माने मोर सेफ से कहते किंतु पेसेंट कौन तार फील मैंने पेसेंट केते सक्सेस होची आ गोटे कथा केते एक्सपेंसिव होची कंपैरेटिवली ओके कारण आप तो कहले दिल्ली रे एटा जनरली सब करूछंती दिल्ली प्राइस केते एठी ओडिसा रे प्राइस केते आप केते टका केते इंट्रोड्यूस करछंती से डिटेल्स तो कहंदो
ओके तो रिगार्डिंग योर आपनकर प्रथम जो क्वेश्चन हला कि व्हाई कैंसर तो एक्चुअली किसी स्पेसिफिक ना जे कैंसर आम प्रथम स्टार्ट कलु आम कैंसर को बेसी प्रमोट करिया को चाहूँ बिकॉज यही सर्जरीटा मोस्ट एडवांस जो बेसिकली कैंसर पेशेंट माने आम ओडिशा रो बहुत बाहर को जाइए रोबोटिक सर्जरी करूछंती से आम चूज देखिलु कि आम ये आरंभ करुचु आ प्रोग्राम को फास्ट ट्रैक करुचु आम कैंसर पेशेंट सब आउ हैरान हेबेनी आम रोबोटिक सर्जरी सब डोर स्टेप अवेलेबल करि परिबु फर्स्ट सेकेंडली आ परे परे आउ सब डिपार्टमेंट आम लाइन अप रे अछंती मोस्टली इन द 3 months ऑफ टाइम वी विल स्टार्ट ऑल डिपार्टमेंट जो जो थे रोबोटिक एम्बिट रे आसुची we will start all the program in 2 to 3 months of time. Surgeons they are in the pipeline actually. It is the matter of time actually. So there was a launching since our cancer center we have launched. So for that reason I may decide kalu ki nahi we will start with our cancer program. So there is nothing like which department first or second. And there is a need of the program for cancer actually in Orissa. Second, regarding patient safety. Definitely it is much safer for a surgeon who has trained in robot je trained achi definitely this is one of the safest approach for doing surgery. Regarding third, cost. For a average robotic surgery performed in cancer, especially I can tell you in my department, the cost will be averaging around 50 to 60 or 70,000 more for a patient. So I don't think एटा बहुत अधिका एते प्राइस नहीं जे लोक माने ऑप्ट आउट करिवे रोबोट नहीं तो कॉस्ट बहुत अधिका नु एक्चुअली तो for that reason Dr. Alok Srivastava and we discussed and आमे भी प्राइस सेतिकी ही रखिछु almost like 50 to 60 or 70,000 but depend upon the patient conditions also. So for initial pricing, initial cases almost we have neutralized. So we are not almost not charging for few cases. That's our plan. And Orissa is a 2-tier city. Definitely we cannot charge more than those metropolitan city. We will keep our charges as less as possible.
केते पेशेंट एवरेज रहउचंदी ओडिसा रो जाउचन माइग्रेटेड होउचंदी
For robotic.
रोबोटिक
See, that data I don't have, but really what I feel, probably around 5 to 10 cases each month.
The nomenclature of Da Vinci, whether the Leonardo da Vinci and Da Vinci robotic surgery. Number one, about it, what is the difference between it? Because one is artistic and other is surgery fellows. Number two is the Da Vinci robotic surgery is meant for what we say the prostatectomies, or otherwise for use of cardiac valve repairing or renal repairing, all these things. Would it extend to that extent that everything can be done within that the robotic Da Vinci robotic machine? Number third, the third number is how much does this robot costs?
So, can you take over the question? Okay, fine. Okay. So regarding the name, regarding the for nomenclature, it's a company which has given the name. So it's not like it's something artistic about it. Okay. So that is view. I think that nowhere it's written actually. Why the yeah, everybody knows. No, before the ambit of before the surgical program came for robot in early 2000, robot has been used for many purposes, industrial purposes. Right now, a team of surgeon in United States, they have started the program initially, and this program led by a company who has been assigned this surgical program as Da Vinci. So why this name? I cannot answer your question. Number two is regarding prostatectomy. Initially, the surgery, the robots who have designed, they apply the robot for urologic surgery, as you rightly pointed out. So robotic prostatectomy, okay, that is the very useful surgery, because laparoscopically doing a robotic radical prostatectomy for prostate cancer is a very challenging task. So use of robot simplified the surgery definitely. बहुत simple है गला for doing those prostatic cancer. Regarding extension of robot to all surgery, definitely not. All surgery cannot perform by a robot. Slowly, as technology improves, most of the surgery can be done.
So as regards the program scope, the current robot will cater to urology, general surgery, oncosurgery, but not to head and neck. You are asking about. There are different types of robots which are specifically meant for those kind of surgeries. Currently, we are starting this program with 5 specialties to be addressed. That is what exactly is the.